Welcome to our bi-monthly SCI in-service. Today, Dr. Danielle Vitale will be discussing ketogenic diet in spinal cord injury.
Hi, everyone. Like Dr. Abramoff was saying, I'm going to be talking about ketogenic diet in spinal cord injury patients. So first off, what happens in spinal cord injuries? There's usually a primary injury, whether that's mechanical, it could be trauma, it could be oncologic compression. There's basically many things that can cause a spinal cord injury. But weeks or days down the line, there's also a secondary injury, which it ends up activating multiple signaling pathways that can cause oxidative stress, it can cause inflammation, and it's going to induce apoptotic pathways that can overall basically worsen the spinal cord injury that already occurred. But there's been studies that have shown that potentially preventing the secondary injury or inflammation can actually improve the neurologic function of spinal cord injury patients. So that's kind of where a ketogenic diet comes in. So first off, what is a ketogenic diet? It's usually a 3-to-1 ratio of a high fat to low carbohydrate and protein diet. There's been a lot of research that have occurred with ketogenic diet in general, but ketones specifically have been shown to have some neuroprotective properties. It can overall prevent oxidative damage. It can prevent neuroinflammation, glutamate excitability, and overall inhibit apoptosis in like the brain and spinal cord. So there was thought about maybe the ketogenic diet, since it has all these protective properties like inflammation, antioxidants, could this improve the secondary injury that occurs with spinal cord injuries and prevent spinal cord degeneration? So just to kind of dive a little deeper into the mechanism of ketogenic diet, so basically you have fats that are going to be converted in the liver to ketones, and these are usually the 3 basic types of ketones, bodies that you'll end up seeing. And this will basically be an alternate source for the brain rather than glucose. And like I was mentioning, there's multiple different mechanisms that ketones can play a role in our body, and the most important one basically is going to inhibit the inflammatory cascade. It can do this by the inflammatory mechanism that I kind of wrote right here, but overall, basically, it's going to decrease the IL-1 and then IL-18. And basically, these are important proteins that are involved in the inflammation cascade. So once you have a decrease in those, it's basically going to prevent further tissue damage, further inflammation, and decrease basically neuronal death. A second thing is, like I was mentioning, is that ketones can reduce reactive oxygen species and oxidative damage. And it can do this by increasing NADH oxidation. And the last thing is it's going to activate uncoupling proteins in the mitochondria. So it's going to increase antioxidant enzymes such as SOD1 and 2, as well as NADPH dehydrogenase. So because of this, because of all the research that has been shown in regards to ketogenic diet and just ketones in general, there was studies that have came out of whether we can use this in spinal cord injury patients. So the first study I want to talk about is a randomized control trial that was single mass that was done at the University of Alabama in Birmingham. And they ended up having 60 patients, ages 18 to 60, and these were traumatic spinal cord injuries who were C5 to T12, and they were anywhere between Asia A to Asia C, and they were admitted to the acute rehab. So they basically randomly assigned these patients into 2 groups: ketogenic diet, like I mentioned before, where it's mostly a fat diet, 75%, and then the remaining was like a protein and carb diet, versus the standard diet that was 50% carbs, about 30% fat, 20% protein. And they analyzed these patients at baseline. So this was within 72 hours of injury. So that was their baseline. And then at the 5-week mark, which was typically around the time that they were discharged from the rehab. They were assessing multiple different things. That was motor and sensory. They were assessing functional independence, glucose control, and microbiome composition. They were monitoring adherence to these diets as well, because they're checking the ketones at least once a week and making sure also that their ketone concentration was within a safe range as well, and that it was nutritional ketosis. So like I was mentioning, they were measuring multiple different things between the 72-hour mark as well as at the 5-week mark. And they were first off assessing markers of inflammation, whether that was CRP, lipid panel, liver enzymes, multiple different things, just because that kind of has a baseline lab work. They were doing ASIA exams at the initial site of injury as well. And they were doing electrical perception thresholds, otherwise known as EPT. So this is basically a sensory test that they will do, and it can overall assess, can this patient feel electrical stimuli in different dermatomes, and kind of assess in hertz what is the highest intensity in order for them to feel something in each dermatome. So it just basically gives us more of information about their sensory perception when they have a spinal cord injury. They were looking at functional independence, otherwise known as SCIM, and this is basically just measurements of daily activity, whether it's dressing, self-care, or bathing. And then they lastly looked at the microbiome by doing stool samples. So one of the most important things that they ended up finding in this study was that the upper extremity motor function increase in the ketogenic group. Like you can see on the top, I don't know if you guys can see my marker, but in the ketone group, there was an increase in the motor score on the ASIA exam for those that were in this ketogenic diet. It was found to be statistically significant, so the P was less than 0.05. In comparison to the standard group, which basically showed no difference and was not found to be statistically significant. You can see on this as well for the lower extremity motor score, there does seem to be a difference in their score from the ASIA, but it was not found to be statistically significant. So overall, this study was basically showing that there was improved upper extremity motor function in the ASIA exam following the 5-week mark in those who had a ketogenic diet. They also ended up finding that there was a reduction in inflammatory proteins that was fibrinogen, and they think that was basically plays a part in why the ketogenic diet has been able to help patients with spinal cord injuries. This was strictly preliminary data that the program was doing, so they're definitely coming out. They wrote that they're doing a further clinical trial for getting the rest of the data that I was mentioning, but this was the preliminary that they basically found for right now. So the second study that I did want to talk about was very similar, similar concept, and this was a longitudinal randomized study. And the three things that they were looking at was a ketogenic diet safe? Could it improve neurologic function in spinal cord injury patients? And then the last thing was identifying biomarkers that are overall affiliated with this improvement in a ketogenic diet. It was a very small study and they were aware of it. There was only 7 patients. They were C4 to T11, ASIA A to D, and then they were randomly assigned to a ketogenic diet or a standard diet, similar to the last one. They assessed these patients within 72 hours and then following discharge, or right before discharge from the acute rehab. They were assessing the ASIA exam, they were doing resting energy expenditure, and then basic lab work, again, to making sure everything was within normal limits. And they were assessing the ketones once a week as well. So this is kind of some information basically about all of the patients. You can kind of see what their ASIA exams were on this left-hand side and what level they were. They showed you how long they were in the hospital, how long they were in the rehab, and these were just the basic labs that they were assessing as they were there. The first column that you can see is that's the ketones, glucose, liver panel, or cholesterol, sorry. So these were just the basic information that they were intaking. So what did they end up seeing? It was actually very similar to this last study that I was just talking about, where they noticed that the ketogenic group demonstrated an increase in the upper extremity motor scores. So prior to, at baseline, they were basically showing that the score was 24, and then after the 5-week mark, it was 38.7. This was found to be statistically significant as well, but it was only for the upper extremity. The standard group similarly showed no change. There was no difference between the two, whether that was sensory or motor, which I do find it also interesting that, again, there was no lower extremity motor change. It was strictly just upper motor change. You can see on one of these graphs, I don't know if you can see it here, it's in image A. It does look like there was an increase in the motor score for lower extremity, but it wasn't found to be statistically significant. So overall, this research study was very similar to the one that I was talking about before, where it did show that the upper extremity motor scores were higher in the ketogenic diet compared to the standard diet. They did assess multiple biomarkers to kind of see what is the cause of why the ketogenic diet is allowing improved neurologic function. They did notice that there was higher levels in the ketogenic diet of an anti-inflammatory protein, which was lysophospholipid, and then also lower levels of an inflammatory protein, fibrinogen. So both of these combined could be also a reason why the motor scores are improving, because it was increasing that secondary injury that typically occurs after spinal cord injuries. The one thing that interestingly they did find, even after the 5-week mark, is there was changes in the ASIA classifications for 2 of the patients. So one of the patients went from a T10 ASIA A to a T11 ASIA B, which we know is A is a complete spinal cord injury. So there was improvement in the classification for this patient. Similarly, their C4 ASIA C patient moved to a C5 ASIA D, which again is improvement in the classification of spinal cord injuries. Overall, these studies definitely have limitations. When I was doing research on understanding ketogenic diet and spinal cord injury, there was a lot of limitations in studies that have currently taken place already. It seems like a lot of the studies have mostly been with animal clinical trials with rats. And if there was some clinical trials, there wasn't always a large sample size, like in the second research study that I told you about. So there definitely needs to be further research on the ketogenic diet, but it does have some promising, especially in regards to improving upper extremity motor scores in these patients. And I do find it interesting still. I think there needs to be more research on why it's strictly upper extremity versus just lower extremity for these patients. These are my citations. Any questions?
Yeah, first and foremost, thank you so much. I find this topic incredibly interesting. As a physical therapist that treats for Good Shepherd Pen Partners, I tend to field a lot of conversations regarding nutrition in general, especially with our neurologic populations, from traumatic all the way to neuroprogressive conditions, and it's definitely a hot button topic. I'm curious if, based off of these preliminary findings, if this moves the needle for you in terms of your recommendations for your patients acutely after SCI, if you would go as far to promote something like this ketogenic diet, or you feel like you just need to see more?
I think it would really come down to the type of patient, especially because this research was showing that it was rather in the early side of these spinal cord injuries. A lot of the time, patients that we see in the acute rehab, they could be years out from spinal cord injury.
Yeah.
So I think if it was like an early onset spinal cord injury, I'd be more inclined to probably start the patient on a ketogenic diet. I definitely think there needs to be more studies that can clarify why it's only upper extremity versus lower extremity.
Yeah.
But I think adjusting in the diet, especially if it was a patient that recently had one, I'd probably be more inclined to do so, especially because it will help with inflammation as a whole. And definitely these patients have a lot of inflammation usually. So,
Yeah, absolutely. I know, mechanism isn't always the smoking gun we think it is, but in terms of the effects of fibrinogen, do we know maybe that is just selectively targeting upper motor neurons, just motor neurons in general, more than sensory neurons? Is there anything that we know regarding that, or is that still just kind of in that preliminary field if we need to learn more about this mechanism?
yeah, I think they definitely need to learn more about this
Yeah.
mechanism. The only thing that they were mentioning basically was that it plays a role in the inflammatory cascade. And since the ketones are basically inhibiting the inflammatory cascade. They think that's why it's basically just going down. And that they were saying sometimes there are other factors that happen in spinal cord injury. I think it was basically they were talking about it can affect like the vasculature, and if there is less inflammation, that's probably also why these levels are going down too. So yeah, I think there's definitely needs to be more studies about it. It's just something that they started to notice it was a common trend with both of these research studies of why specifically on like a molecular level is the fibrinogen basically going down.
Yeah, really interesting. Really. I mean, obviously very small sample sizes, but definitely I would be curious to learn more about it. But and I think the last consideration for me anyway would be how would this affect in terms of adverse reactions, the bowel management for that individual, right? I mean, if we know generally that this is kind of changing their typical ratio of carbs to protein, is that leading to increased difficulties with stool and bowel management, and is the juice worth the squeeze, so to speak, if it is? I don't know if any of these studies reported on that.
Yeah, none of them have reported on changes in bowel regimen. I think that's something that they haven't even looked at. I would basically just assume that they would have more fat in their stool. So there would definitely be like a change in the composition of the stool samples that you would definitely notice. Whether I think that's going to change the bowel regimen, it would probably not. I would probably keep on like the typical spinal cord injury regimen. It might just change maybe the frequency sometimes of the bowel regimen, but I wouldn't see it affecting too much from the typical plan.
Yeah, great. Thank you so much. I appreciate it.
Of course.
That was really great overview, Danielle. I have a few questions. So how are they controlling the diet? Do you know? Like, were they just giving them keto diet?
Yeah, so they were basically saying that they were working very closely with the kitchen at their acute rehabs and making sure that it was standardized for each patient. And I think, I'm not sure if they'd basically be getting the same meal, each of them, but it was definitely within the realms of the same percentile for carbs, for fat, for protein for each patient.
Did they go into anything about like who dropped out? Like one concern I have is that like the people who are able to adhere to a very strict diet and limited diet, are they more like motivated, younger compared to those who like get started? We know from our, experience that you can tell people stick to the diet all you want and they may not, so did they go into that at all in the dropouts and things like that?
They didn't mention that any of the patients were excluded for like non-compliancy. They did exclude some spinal cord injury patients based on the specifications of their spinal cord injury. I think one of them was like I forget the specifics. One of them might have been central cord or something else that had like more promising effects. I forget the specifics, but they excluded prior to even starting the research. It wasn't during for non-compliancy at all. And they were testing to make sure they were compliant by checking the ketones each week. So they would expect that the ketone levels were higher in the ketogenic diet. So they were monitoring it also to make sure that they weren't just bringing in food from outside as well.
And these are in the kind of subacute period, all these patients?
This was acute. This was at spine rehab at UAB.
And so what time frame? Like, did they 8 to 4 weeks after their injury to 12 weeks? Did they kind of specify?
They really only just said that they were assessing them right after the injury and then right at the discharge. So it just seemed like, yeah, I guess the timeline doesn't really make sense because within 72 hours of injury, you wouldn't go automatically to an acute rehab. But that was basically what they were writing in the articles. So I'd have to double check on that.
And just out of curiosity, do you know if there's been research on other diets for spinal cord injury?
I didn't look into it. I'm not sure.
Yeah, I think the literature in this area is very sparse. And then, do you know if they're like continuing? Like, I think these articles are from several years ago now. Do you know if they're continuing any of this research? Have you seen anything on that?
Yeah, the first article mentioned that they were doing a larger clinical trial.
Okay.
I'm not sure if it's still in the works right now, but one of the articles was a few years ago, so I'm assuming maybe they're still working on it, but they were doing a larger scale of it.
Mhm. Well, I think for me, if I had a spinal cord injury, I'd say put me on the ketogenic diet.
Yeah.
There's so many limited, treatment options available, and even if it's like
Yeah.
a 1 in 10 chance, the risk,
Hmm.
maybe I think Matt makes a good point. It could mess up your valve,
Yeah.
or in terms of if we could benefit neuro recovery, that's kind of the more important
Hmm.
step. Maybe something we could think about. I'm sure like the coordination with the kitchen and everything is not an easy thing to do, kind of in that setting.
Yeah, and I think the biggest thing that they also mentioned was they noticed a worse prognosis for patients who had high sugars when they were admitted originally for the spinal cord injury. So definitely having a low sugar diet, um, which is involved with a ketogenic diet just at baseline, played a big factor in their recovery as well. So I think making sure their glucose was under control right at injury and then right after was also very important.
Yeah, that's a great point.
Yeah,
Is
I
it
think
really the ketosis or is it something else? Yeah, go
Yeah,
ahead.
Yeah,
I was just saying
I
because
think that hits the nail right on the head with that one. It just how much of this is the ketosis effect versus just lowering that blood glucose
yeah.
and the inflammatory aspects of that, right?
Hmm.
I'd be very curious if that was a follow-up study, just managing that, what you would see,
There was studies already, I think, done. I didn't look too much into it, but they were talking about it in their articles as well. But they were citing some sources, so I'd have to look more into what specifically was done. But they were both emphasizing how high sugars was basically worsening like the secondary injury and spinal cord injuries.
Yeah, very
Yeah,
interesting.
I think there have been some articles on kind of low inflammatory diets in
Yeah.
spinal
So it'd
cord
actually almost
injury,
be
but
interesting to compare like ketogenic diet versus like a carb controlled diet too, since they both are in the realm of like low glucose.
Yeah,
and certainly the goal is, neuro recovery. These studies need to happen early on. I think they have to do it in the, that subacute acute rehab period and
Mhm.
not, the chronic phase. Because I think the potential of any type of benefit in the chronic phase is from a neuro recovery standpoint. Now, maybe there's good metabolic health
Yeah.
type outcome, but I think the time to strike is early. Any other questions? Well, Danielle, thank you so much for a great presentation. As always, this presentation will be available on our resident SCI YouTube channel. So thanks everyone, and we'll let you go. Thank you.
thank you very much.
Thank you.